Hey now, cats, we're back again this week on the Balls from Ellwood show. And with me today, I am excited to have a man Balls grew up on watching on such shows as MTV's Love Line, Celebrity Rehab. He's a media sensation with several podcasts of his own. And on top of that, he's an addiction and relationship specialist. He's an internist, not to mention one of my favorite past guests on the Howard Stern show. Please give it up for the man, the myth, the legend, Mr. Dr. Drew Pinsky. Thank you so much, Dr. Drew, for being on my
It's
show. I
a
appreciate it.
pleasure to be here. I appreciate that. It was a very kind intro. First time, though, I can remember anybody ever describing me as having watched balls growing up, or while growing up, balls watched. Whatever it was a phrase I've never heard uttered before.
Well,
So
I'm
here
glad
we
I could
are.
be the first. So
Uh,
I'm going to hit the ground running. I got so much stuff I want to talk to you about. I appreciate you being here.
hmm.
I'm extremely thankful to have you here today. So I'm not going to waste any time. So before we get to it, can you give me a little insight as to where you grew up at and what your life was like as a child?
So I grew up. I was born and lived initially in a place called Alhambra, which is deep in the San Gabriel Valley here in Southern California, which is, where such cities as El Monte and Duarte and all these
Yeah.
great towns. If you go further out, you get to Azusa and Irwindale. The San Gabriel Valley is it, let's just say in the summer, it's like living in the mouth of the sun.
Oh, wow.
It's super hot, super flat. But for a minute there, it was a sort of suburban paradise for young couples. And so my parents settled there and moved out of there to Pasadena when I was still a child, and grew up. My dad was a doctor. My mom had been a performer. She's a bit of a long story. I can tell you that story separately, but she was a housewife by the time I came around, and grew up sort of upper middle. I went to private schools, which was the greatest gift my parents ever gave me, which was a $1 zillion, a world class education. It was by far and I valued that so much. I vowed I would get that for my kids. I don't know that they valued it as much as I did. It's kind of funny, but we'll see as they have their own kids. I don't know, then I went out to New England and went to college. How much more would you like to know? There's all kinds of things I could talk about.
Well, actually, what I really wanted to know was, did you always have dreams of helping people, or did that come to fruition later in life?
I My dad was a old-fashioned family practitioner, and I learned a lot from him. And I just always thought that's what I would do. I was good at sciences, that kind of thing. However, when I was also good at a lot of stuff like music and things that I wanted to explore. And I went to my first year in college at a, super high-powered academic institution and had my ass handed to me. I performed well. I did very, very well, but it was just such an ass kicking. I announced that I'm not up for this. This is not for me. This is for somebody smarter than me. And by the way, I was around incredibly smart people, like goofy smart. Like you don't come up in a small environment like that to have had competing with so many brilliant people was extremely what's the word I'm looking for? Intimidating. And so I spent about a year just drifting. I thought I'm going to become an opera singer. I'm going to go to West Germany. And then I didn't know what the hell I was doing. I did some plays and theater, and I was all over the place. And as time went on, I got more and more and more miserable. And actually, I left Amherst for a little while and then came back. And I was depressed during that whole time. I was having panic attacks and depression, and it was just, and then I was mistreated. The treatment I got was just shitty as hell. But when I contemplate, I would never let myself contemplate going back to the sciences. But one day I just sort of thought, I think when I was pretty good at that. Maybe I'm meant to do that. And I instantly felt better. I mean, instantly. It was weird. And so I got back to it by my junior year and had to really apply myself, and loved it. I had to go to school year round and whatnot. And I didn't actually expect to get into medical school first go round. That was a miracle as far as I was concerned. But when I got back at it, I had to, do at a higher pitch than I was when I was so disturbed as a freshman. And lo and behold, I could do it. And in retrospect, I think, aside from the fact that I was now committed and really liked it and was looking forward to it, I think my brain had matured to the point that I could handle it.
Hmm.
Also, my depression had settled down a bit. And so there was a lot going on that, was impacting my academic career at that point. So then I went off to medical school and I loved every second of my training. I was so grateful to be in it. I was in the middle of the AIDS pandemic when I was a resident, and it was just an incredible time. Dark, just a dark period you can't imagine. It's why I got involved with radio. One Anthony Fauci was encouraging us young guys to get out there and educate about this thing we were just starting to call HTLV3, which we now call HIV.
Hmm.
And he kept saying there'd be 2 million dead if you don't get out there. And I had this opportunity to go on the radio one night and did it, and was just amazed that no one was talking to young people about this thing that I was dealing with all day long. And so that was sort of what really propelled me to kind of keep coming back and answering questions. As far as helping people, I was so grateful to have a skill and a purpose that could help other people. That was like, that captured me right from the beginning. I was like, I remember like my first year of medical school. I remember going back to my car, and I'd always park on the roof of this parking structure. And I walking in there one evening. I thought, oh, this is so great. I'm so happy to be doing this. It's such a purposeful, important thing. I thought it was so important. And then, the psychiatric thing happened during residency. I started moonlighting at a psychiatric hospital, and then got fascinated with that. And that's really, I think, where more explicit service came into the picture, when I started working with addicts and things like that. Because before that, I was really sort of scientist, clinician, I liked ICU. I was going to be a cardiologist. I was sort of heading that direction. And, I liked intervention. I was good with needles and things. But the decades I spent at the psychiatric hospital, and then having to do my own work to be able to be effective in those environments, that's when the real ideas of service started coming in.
What I wanted to ask you is, I mean, you've had a lifetime of hearing people's problems and diagnosing them and things. Is it hard not to take your work home with you? Meaning, you hear heroin shit all day. I mean, does it ever weigh you or affect your mood and attitude? And how do you keep a healthy balance between work and home?
It's as I've gotten older, it creeps in a little more. When I was younger, I always thought, it's like being an ambulance driver. You come upon these things, you have something to offer, you do your job, you do the best you can. But what started happening, particularly with the psychiatric patients, is they started mobilizing my own stuff. And this is a difficult concept for people to get, but if you don't have great boundaries, when you're around people that have been traumatized and injured, if you haven't had treatment for your own trauma, you naturally want to rescue them from theirs. Not because they need rescue, because that just makes them forever dependent on rescuing. Because you need the pain to stop, because their pain mobilizes your pain. And you can't really see it if you're not had much treatment. So then I went into therapy myself for many, many years. And that was an extraordinary experience. And here's something interesting. With the way because Howard's been on the couch so long, with the way he conducts his interviews, very familiar to me. It feels like emotionally focused therapy.
Well, let me ask you this. I mean, has there ever been a time where you just kind of get sick of hearing people's problems? Does that ever happen?
No, I don't think about it that way. I get the way I have to use my emotional systems, particularly at least with the drug addicts, which I started doing obviously a lot of later in my career. You have to use your whole body as an instrument, both receiving information from the other people and it's sort of processing it and offering something back. And it's a non-cognitive, non-intellectual, sort of deep, almost hypnotic process. And I would find I could only do that 1 or 2 days in a row. And then I'd have to take a day off because the mechanism would start to shut down. It just stopped.
Just natural.
And where I really noticed that, I did that automatically when I was running a program, but I noticed it kicked in badly with Celebrity Rehab because like 5, 7, 8 days in, I go, oh no, this thing is this thing I need for these people is it's not working the way I want it to. So I'd have to really kind of pay attention and pace myself as best I could.
Is there a difference between treating, say, a celebrity as opposed to just a regular person?
No, the glib slash glossy, gloss answer is absolutely no different. Like, no, the fact that people think there's a difference drives me insane.
Hmm.
However, like, they have special concerns, but then so does every job. Pilots have special concerns, physicians have special concerns, attorneys have special, judges have special concerns. I've treated them all, but it's not like there's this is what I used to have to say, because people back in the day, people had weird ideas about this. I'd say there's not a handbook for diagnosing celebrities and a handbook for the treatment of celebrities. It's they're just human beings. They are treated like everybody else. And by the way, because of the pathologies of people that seek celebrity, which is what I wrote my book about, if you treat them specially, you have a problem. It doesn't go well.
Actually, what I wanted to ask you, Dr. Drew, is have you ever treated someone so dangerous that you have feared for your life, and how did you persevere through that?
Yes, but mostly it's been environments. I mean, it's been in controlled environments where the patient gets out of control, but I still have resources and staff and things that kick in. One of the craziest one, I'll give you an example. I was, I used to work a lot in a psychiatric intensive care unit. That's a locked unit, bars on the windows, and it's where the sick people are. And I did a lot of consulting in there. And there was this guy in a cowboy hat, in his underwear, in big cowboy boots, marching up and down the hall, just marching up and down the hall, and very agitated. And I thought, okay, I didn't bother him. He didn't bother me. I went in a room to examine a patient, and all of a sudden I hear him go, woohoo! And I like, uh-oh. So I thought, maybe I'll shut the door. And I hear bump, 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 going down the hall. And now I thought, well, I better see what's going on. I go out. Now he's got one boot on, and the other foot is, he's dragging this boot around, and he screams, "I figured it out," which is what bipolar manics often say. They feel this inflation, like they understand everything. Mm-hmm. And he broke into the nursing station, grabbed furniture, and threw it through one of those windows with the wires in the glass. And then dove out the window. I was like, oh my goodness. And so I got a posse together, and we surrounded him and got him, and we were able to kind of land him. It was one of the wildest psychoses I'd seen, and I've seen many. And that was, that you get the sense that anything could happen. And he was very aggressive and very violent. But again, I had a lot of people around me who knew what they were doing. We got him talked down. We brought him back in. And this is why it drives me crazy about, how homeless are treated, because they're treated by social workers and law enforcement who have no training in this, or not medical people. They don't know how to do this. I
thought about that. Yeah, that's a problem.
Oh, they're running outdoor hospitals without doctors and nurses. It's unconscionable. But that's one of my topics. It's one of my things.
Being an addiction specialist, Dr. Drew, is there one person in the public spotlight now that you wish you could convince them to let you treat?
I don't approach it that way. You know what I mean? There's people that I think to myself, I could help them, but it has to come from inside. They have to be motivated. You can do things with them. You can bring them into a structured environment. You can motivate them in certain ways, but I don't think about it in terms of I'm going to go save that person. I just think if they, the way I really think about it is I think, I'm probably going to get the call on that guy. I'm probably going to get the call one day, and usually it comes.
This next question actually kind of is relatable to myself. What is your opinion on people using Ozempic-like drugs to lose weight?
I am very in favor of it. However, I'm concerned about the excessive use and the people using it to lose, 10 pounds or something don't have, if you use a medication for non-medical reasons, right? You
Okay.
don't have a specific diagnosis so you can understand what you're doing, what you're trying to treat. If you're not trying to treat something, you can only do harm. You can only harm people with pharmacology. That's all you're going to do. Now, they may lose the weight, but there's no therapeutic benefit in the sense that they are medically going to do better. If somebody has significant weight issues and has tried lots of reasonable things and would like some pharmacological help, well, that makes good sense to me.
Mm-hmm.
But we have to understand that it is not a panacea. It's not without risk. I mean, you and I have talked a little bit about this. I'm starting to see, the way things work with medication. As soon as people start using something widely, you start to see the unfortunate side effects eventually. And then once they start, they really kind of come. And after you and I last spoke, I've seen a bunch more.
Oh, wow. Seriously?
Yep.
So I'm not the only one.
You were at a leading edge for me. So starting to see stuff, and then I see a bunch of it. And I think I worry. So what are the things to worry about is vomiting and diarrhea. Worry about sort of inappropriate weight loss in the sense that you're having protein weight loss, and we don't need to know the effects on the kidney and the heart for all that yet, but I think that's going to be okay. We have people developing gastroparesis, which is a dreadful problem, and that seems to be permanent. And I'm of the opinion that Manjaro in particular, which has a central effect and a gut effect, right? The Ozempic is primarily gut, but the Manjaro is equally both. If you start screwing with people's motivational systems, you're going to have side effects that are very difficult to predict. Depression, loss of libido, loss of who knows what desire that we normally have. I mean, our motivational system is a key component. I mean, look, Freud's theory was a drive theory. His entire theory of psychoanalysis was based on drives. And drives are what are interrupted by things like Manjaro. So God only knows what those effects will be long term.
How do you stay up to date on the current events and drugs in the healthcare medical industry? Is there a certain place you could go? Do you have to study? Like,
you have to study. You have to read. You have to read.
Is that like a nonstop job?
While I was waiting for you, I was reading a journal right now, and I read 3 journals top to bottom every week or two, and I have a lot of continuing education I have to do because I'm way up the food chain in terms of my certifications. I'm a fellow with the American College of Physicians. I'm a fellow with the American Board of Addiction Medicine, and I have to keep up on all kinds of continuing medical education with those. And I like doing that. I enjoy it. But to maintain those things, you have to be it's all the time. And I keep practicing. I'm nowhere near the kind of, the volume I used to see. I mean, I saw everything. Now I'm at a very, just people I've followed for many, many years. But I do still get to interact with subspecialists. And that is always very informative. What are the subspecialists doing right now? What are they up to? How are they deploying certain medication? And that's a key component of how internal medicine kind of works.
Now, have you ever disagreed with another physician's diagnosis, and how do you handle that?
All the time. And humility, because I could be wrong too. I'll present a case to you. I had a woman I care deeply about, who, and I'm not going to identify who she is, but somebody I'm really close to and have been for a long time. And her ophthalmologist called me at like 8:00 at night. Oh, she has temporal arteritis, which is this dreadful, giant cell arteritis, inflammatory disease. And she's got this, and that. I'm getting her sed rate right now. Calls me back an hour later. Well, sed rate is normal. I'm like, okay, well, let's kind of cool down about it. Saw her again 2 days later. It didn't fit for me. I was like, this isn't temporal arteritis. Got a sed rate a couple of days later. It was up, not in the temporal arteritis range, but up in like disconcerting range. I said, let's just keep watching. Checked it again. It went back down. Checked it again. It went back up. And so I'm starting to think she might have something going on. And so I disagreed and I turned out being wrong. But because I would have humility, I kept checking. I kept I didn't jump right into high doses of steroids or getting a temporal artery biopsy, because those have serious consequences, but we may end up there. In the meantime, she's been doing fine. But that's kind of how medicine works. This is how it works. People don't understand. It's not like, this world of follow the science it could not be further from how medicine is done.
You feel the media and the internet contribute to people's addictions?
It certainly contributes to their dysregulation. Okay. And at the core, emotional dysregulation is why people reach for drugs, right? It's usually trauma that creates this significant dysregulation. So emotions are too prolonged, too intense, and too negative. And so people can't get out of that cycle. So they don't know how, because the trauma left them with this thing on their body that they can't access. And they reach for something to feel better. And once they find it, they often feel better for the first time in their life. And it's very hard to talk them out of it at that point. And then if they also have the genetics for addiction, which, the fact that they found certain drugs so highly effective, that kind of is already in the drug addict zone. You have to feel really good when you take these things. Like when I take Vicodin, I feel like shit. I hate them. But my patients can't understand that, because they love it. And often feel for the first time relief in their life, and and off they go, and then the switch gets thrown on the addictive pathology. So now you have two things: emotional dysregulation, which is usually from trauma, and then addiction.
That actually leads me to my next question, Dr. Drew. How do you prepare yourself mentally to tell people or their loved ones hard information that they either probably don't want to hear or accept?
There is no way to prepare yourself. It is having done it a billion times, right?
Oh,
I mean, I can remember.
It never gets any easier?
Easier. It's always unpleasant. It's always unpleasant. And frankly, if it weren't unpleasant, I wouldn't be doing my job. Well, let me tell you a story. The first time I remember participating in telling a family that someone was dead, I was on a neurosurgical rotation. This case was sort of helicoptered in for us. I was with a neurosurgical resident. We walked in the room. The guy was on a ventilator. He was brain dead. Brain dead. And I don't know if it just happened or what, but this was not a living, their heart and lungs were going. It's on all the breathing machines and whatnot, but the brain was gone. No reflexes, no nothing. And so the resident walked out, and there was this whole family there, and he kind of, I can't remember it at the time exactly what bothered me so much, but I thought, oh, I am never going to be like this. This is terrible. He was sort of arrogant and kind of looking off into the distance, like, we just have to accept these things. I have to tell people this stuff all the time. And, it's just the way it is sometimes. And I was like, holy shit, this is terrible. So in internal medicine, by the way, general internal medicine, people die all the time. When all the subspecialists are done doing their thing, they send them back to us to die. That's just the way. I learned that very early. And so you are often in a situation where the surgeon goes, got it all, and then they disappear, and I have to go back in and go, look, this is colon cancer. There is no getting it all. This is not going to go well, but I will stay with you through it all the time. I wanted to refer those things to ethics committees. They never took me up on it. It just was disgusting when they did that. Anyway, I had I had to give some patient I cared about deeply, some information about two weeks ago that I didn't want to give him. And I just have to, you gird your loins and you walk in, but you do not detach. You don't just, you got to be with the people that you are delivering the information. That's part of the job, to be fully present as you do these things. And if you're not able to do that, then you shouldn't be doing that job.
You have a very strong relationship with Adam Carolla over the years. Can you tell me why he hates me?
He hates you?
Yeah, he doesn't like me at all. That's why I stopped calling into his show.
Didn't you call in on our show?
I
with
called
him.
in a few times,
It was he and I though. It was both of us.
he never likes me, man. I don't know. I think I rub him the wrong way. He is not a fan of balls, sir. I thought you might have some inside info for me.
I think you're reading into he has never said anything when you were oh no, that was Mike Catherwood was in there when you called that last time, wasn't he?
Yes,
Because yeah, so it wasn't
that's
Adam.
why it went so well.
Okay. And Mike loves you.
Oh, I
And
love him too. Tell him thank you.
okay, I will. I just don't think Adam has a way of not caring about certain things that feels completely invalidating and scary sometimes. Because when
I
he
am an
doesn't,
intimidating dude. I know.
well, no, it's not that he's intimidated. He just doesn't care. And so if you're trying to get something out of him, he gets sort of weirdly offended. Does this make sense? It's an odd characteristic he has. I'm not being critical. It's just how he would tell me how it is. He if you're coming in with trying to get something out of him, whether it's enthusiasm or a rise out of him or to say something funny, he will be pissed at you.
I,
I'm not kidding.
why I think that might be the issue then. Well,
So if you were just to call and say use a different name and just ask your questions, and use balls, but don't even, but sort of just use it as part of so because he'd already go, what's he doing with this name thing? Why do I have to say the name? Why? You know what I mean? It's just already he'd be off put. So just come in.
maybe I'll call
say,
him as Mike from Ellwood next time.
yeah, Mike from
See how
Ellwood,
it
or
goes.
even Mike Balls from Ellwood or something. Just hide it in there a little bit, and just ask something. And the other thing is he wants to know that you really have a question. He
Oh,
he
yeah,
gets
I always do.
and I have a little bit of this in me too. I get offended by fabricated things, and I was actually worried when you called with Mike that it was going to be fabricated because I think people think of you as at Stern, and some of that feels
I
at
get that. I
times.
get that a lot sometimes, and that's what it kind of makes it hard for people to take you seriously because I really do want to interview people and I do really want to know their story, and
Yeah, I
they just
figured. Oh
assume
no,
that I'm going to fuck with them, and like that's not the case at all. So,
well, no, I could tell. I could tell. And when you called a couple weeks ago, that was a real good question. As I told you, you were leading edge for me of seeing side effects. So I was actually very interested in what you were saying.
well, that means a
And
lot to me,
so,
man. I appreciate it. But
no problem.
I know we don't have a lot of time here, so I actually, before we close, Doctor Drew, can I ask you a few Howard-related questions before we go? Have you ever gotten your lunch date with Robin Quivers?
No, God, I actually forgot about it. I need to do that. Thank you. I will launch back into my efforts to get that lunch date. I
Does
love
it?
Robin. I don't know if she
I
loves me
do
anymore,
too.
but
I mean, does it
yeah.
bother you in some capacity that she never got back to you and claimed you never got any invitations from her? Or you never
Well,
saw
we
her?
went through all that, and I showed Gary all the emails, and she admitted that she forgot.
If you knew what you knew back then, what you know now, would you still have written about her narcissism and the 34 that struck the nerve with her?
100%. But the part that bothered her was that we put it in print, right? That
No,
this is why she was bothered.
that was the contention.
We put it in the book, and my co-author and I, co-author is a college professor, and it never occurred to either of us that we needed permission from her since the whole thing happened publicly on
On the
Howard's
show.
show.
Yeah.
We were just reporting what happened on the show, but she took great issue with that, and that was a lesson for me. Before I put anything in writing, I try to clear with people, even if it's something that there's a billboard out front that says the same thing.
In your professional opinion, who can you tell me that you feel is the most well-adjusted on the show and the least well-adjusted? I have my thoughts, but I mean,
Well, I mean,
I'm not a board certified physician either.
It's a big cast, right? So probably the most adjusted is Beth Stern, right? And so you probably wouldn't have included her in
No,
that,
no, no, I wouldn't actually.
right? But she's part of the show, right? Robin, in spite of her character functioning, that again are traits. Doesn't mean she has a disorder. It's traits we were measuring. She is remarkably well adjusted with her boundaries and things, and I marvel at some of the things she's able to do and say and maintain herself in the face of. So I maybe at one time in her life there were some more struggles, but I would say those are the two. Let me think. Is there anybody else that I'm probably not thinking of everybody? I mean, Least well.
Hmm.
It depends what you mean by well adjusted. I mean, throw some names out. I mean,
I'm thinking Mamet.
oh, Lamette
Yeah,
is
Lamet.
well, Tan Mom would be the least.
Lamet,
So
yeah.
Tan Mom is a neuropsych. Oh no, actually Bigfoot with a Tan Mom is a close second.
Oh yeah.
Those are people with brain disorders. Those are really
Oh, you think
serious.
Bigfoot has a brain disorder?
Oh my God, severe
I don't have a brain
neuropsychiatric.
disorder. It is.
It is he actually talked about his disability and stuff one time. I was listening
Oh, he's
kind of carefully.
fascinating, man, for sure.
Fascinating. I on one of my interviews with Howard, he said, "Who, which of the Whack Pack do you like?" And I said Bigfoot, and he was sort of surprised. I said, "No, this guy's he's a specimen.
Oh my gosh, man! Like, if
He's
you
a
ever bring
thing."
back Celebrity Rehab, he needs to be on there. You should have Whack Pack Rehab.
Oh, I don't think he's too. I don't think he could be. No, no, no. It's an interesting idea, but I don't think he could be treated in that environment. Boy, that would be interesting. I never thought about that. Whoa, you have an evil mind. But like people want me to say Richard, and because Richard's alcoholism and stuff, but Richard hasn't lost control yet, and he's a very healthy person. You know what I mean? You can have that gene and momentum with alcohol and not be pathologic. You know what I mean? It's just a trait. It's just a thing. So I don't know. That's the least well adjusted. It's hard when you have and also, of course, Beetlejuice. So
Do you think JD Harmeyer or Benji Bronk is on the spectrum?
JD Moore.
You think?
Benji, yeah, I think so. Benji, I'm never sure what's real and what's memorized with Benji, right? He's doing a lot for the show, and for the show over the top things he does or says or arguments he gets in with Howard and stuff feel forced and yet feel like they have a foundation in what he's really feeling and thinking. So it's hard to know what's really going on there. But JD, I mean, Howard loves JD, and
Oh
JD,
yeah, he's great.
yeah, I mean, Howard is his like guardian angel, and he really makes sure he has a
He's
great
come a long
life.
way too. If you look at the old footage when he first came on as Jamie, to
Oh
now, I
yes,
think he's really come a long way.
could be his wife. Could be his wife. That brings people around a little bit too.
I got one last question for you, and it actually doesn't pertain to Howard, Dr. Drew,
Hmm.
before I let you go. Has there ever been a sex question presented you in your career that has disturbed you?
Many, many.
Can you think of one offhand?
I mean, there were two that popped that, because we have so many, we would, Adam and I would always be asked, what's the most crazy question? What's the most disturbing question? So, and we would go, every night we have stuff, every night. So we just arbitrarily picked two things that had happened around the time people started asking that question over and over and over again. One was a girl who called. She was a Vietnamese refugee, was left in the streets of Saigon or whatever city during one of the evacuations. And she had a young girl that she was raised with in the orphanages. She called her sister. The sister went to Denver. This girl came to Orange County, Southern California, and she was thriving and doing well. She said, my sister all of a sudden started talking about suicide and was going very dark and was having lots of trouble, and had just confided in her that she was being sexually abused by the adoptive parent.
Ugh.
And it was like, oh boy. And we helped her go retrieve this person. And it was disturbing. And of course, we hear every night about horrible, horrible things that happen in people's childhood. I mean, it's all the time. And then the other one we always bring up is this guy that was having sex with his dog.
Ugh.
And I should say the dog was having sex with him. And he called in, he goes, you guys are supposed to have an open forum here and non-judgmental. He went, okay, all right. He goes, well, why do people freak out when they hear about my monogamous, loving relationship with my partner? And we're like, what's going on? Who's the partner? He went on to tell us about Brutus, the Akita Kali mix.
Oh, Lord.
And we were like, oh man. And we were fascinated by this guy. And it was disturbing and dark. But he taught me a lot about zoophilia, and there's a community and there's this and that. And what was the other interesting part about that call was our call screeners and producer were all women, and they went ape shit. They went, this man needs to be shot. He needs to be taken and dismembered. It is the most horrible human to walk the earth. We are so upset. And they just kept going, kept going, kept going. And at this guy, like on the phone, like just destroying the guy. And finally, and he'd already, he told us about horrible deprivation during childhood, and that's sort of how this all happened. And finally, Adam goes, "Hey," to our call screener and producer, goes, "I want you to think about something. All right, so yes, we agree. This is exploiting animals is not good. But really, who'd you rather be? Would you rather be pulling a sled in the Iditarod, or would you rather be this guy's dog?" I was like, "Oh my God, I'll never forget that." So there's Adam, philosopher warrior.
I think that's a perfect place to end, Dr. Drew. Actually, can you tell me real fast how we could keep up with you on the internet? And,
yes, please do. I'm doing a show now Tuesday, Wednesday, and Thursday at 3:00 Pacific at drdrew.tv, which my wife produces. On Wednesday, I'm joined by a colleague named Kelly Victory, an ER doctor, and she and I have differing views on things. And all week, the sort of predominant theme of the show has been interviewing scientists and doctors who have been canceled. And guys like Jay Bhattacharya and Peter McCullough and Robert Maloney's guys. And I haven't agreed with everything they've said, but I've learned something from, I'd say, every single one of them. And it's been a really interesting experience trying to put together the pieces of the pandemic. It's quite a mystery, many of the things that have happened and continue to happen. But I'm a very moderate, I'm super moderate. I don't take sides at all. And I don't have a political bent. I'm like independent. I don't like what's going on both sides. Well, the excesses bother me.
Well, we will definitely check that out, Dr. Drew. I have to thank you so much, sir. I appreciate you coming by. Always a pleasure chatting with you. There you have it, folks. The man, the myth, the legend, Dr. Drew Pinsky. Thank you so much, sir. Thank you for coming, and I appreciate the opportunity.
Again, something I don't say often. Thank you, balls.
Thank you, Dr. Drew. Peace and love. Peace and love.
Peace and love. Peace and love. Peace and love.
Peace and love. Thank you, sir.
Okay, see ya.